think we're live. We are. All right. We are live. I have everybody sent in. So sorry for the small delay. Technical issues, but we have resolved them. How y'all doing? How y'all doing? All right, guys. This NCLEX Jeopardy is going to be different and more fun because y'all are going to be able to see the questions. Hold on. Wait 1 second. All right, y'all. We about to do NCLEX Jeopardy the right way. How are y'all doing? All right, so, sorry, I'm putting in my earrings. For you guys that don't know me, if this is your first time in NCLEX Jeopardy, welcome. If you don't know me, like I said, once again, my name is Nurse Sam. Hello. You guys probably know me from my creative study kits, NCLEX Jeopardy, Tease Tuesday, whatever it is. But my belief is that when you're entertained, you retain more. Okay, so I help nursing students, both RN and LPN, have some fun while they're studying so that they can retain more and be able to recall it later when they actually need it, aka during test time. All right, so I have helped over 25,000 nursing students get through, and get out of nursing school, as well as pass their NCLEX. So I am here to make sure you guys do that as well. Okay, so I came up with NCLEX Jeopardy about 2 years ago. Yeah, 2020-ish. I came up with NCLEX Jeopardy about 2 years when that basically is your typical NCLEX review, but it's actually NCLEX Jeopardy style, or Jeopardy style, I should just say that. Okay, so as you can see, blue screen, 5 categories, and 5 questions per category. So it's your regular review, but it's just in a fun format. It's in a fun way where it's giving you the same content, the same instructions, but you're just doing it in a fun, less overwhelming way. All right, so couple things. If you guys have never played NCLEX Jeopardy before, this is how it's gonna be. For the first time, I'm going to show you guys the questions on the screen. I'm trying this out to see if this is something that y'all want me to continue. So make sure y'all giving me feedback, especially when I ask at the end. You guys are going to be able to see the questions right when I'm pulling them up. So I'm going to read the question and the answer choices, but you'll also be able to see them. Okay, y'all know this is for visual learners like myself, so I had to make sure I had a way to make sure that you guys were able to see the questions as well as listen to them. It just goes further. It goes a way longer way, okay? So I'm going to read the question, read the answer choices. You guys are going to be able to see it on the screen as well. You guys are going to answer in what is format. Once again, it is NCLEX Jeopardy. It is Jeopardy style. So in order for you to get the points, okay, you have to answer the question in what is format. So if the answer is the second option, you'd say what is 2. Okay, if it's number 3, you'll say what is 3, but you have to say what is. Okay, it's Jeopardy style. That's what we do to make it more fun and a little bit competitive. Okay, we are playing for points. Okay, so I'm going to have my digital scoreboard right here in addition to my questions, and we're going to, like I said, play for points. The person with the highest amount of points is going to win a prize. They're going to win a free copy of the digital Ultimate Nursing School Bundle, a $97 value. Getting it for free. Thank you so much for participating, all right? So this is just my way of reviewing with you guys, kind of having like a small little study group. And then, like I said, we play for points and just kind of have fun with it. A little bit competition, never hurt nobody, right? Okay. So one thing is, just in case we have some lagging issues as far as connectivity, I can only go by what I see on my screen. So if on my screen, Beyonce answered before Michelle, the points go to Michelle. Beyonce, my bad. Points go to Beyonce. All right, so whoever answers first on my screen, they may come up third on your screen. I'm not sure, but I can only go by what's on my screen. Okay. Alrighty. So, if y'all have any more questions about gameplay, write a comment, and either me or another vet will answer that. Okay. All right. So, as you can see, we have our scoreboard right here. Let's go ahead. I am going to go to our first question, okay? Once again, this is NCLEX Jeopardy. I'm about to show you guys the question, and that's how we're going to play, okay? All right, so let's go ahead and do question number 1. This is Fundamentals for 500. All right, Fundamentals for 500, this is the question. Here we go. A client has a prescription for an injection to be administered by the intradermal route. The nurse should avoid which action when administering the medication? 1. Injecting the medication slowly. 2. Massaging the area after removing the needle. 3. Inserting the needle at a 10 to 15 degree angle. Or 4, making a circular mark around the injection site. What is our answer? Do not forget, this is NCLEX Jeopardy. So in true Jeopardy style, you have to answer, you have to preface your answers with what is. All right, so what is, and then whatever you see. Just like they're doing right now in the comments. Go ahead and answer. All right, when you're doing your reviews for your NCLEX, try to go for a minute per question. All right, that's including reading and answering. Try to go to about a minute per question. Okay. All right. So getting a bunch of 2s, but let me scroll all the way up, and then we're going to see what our correct answer is. All right. 1 second. All right. So let's go and see what our answer is. And drum roll, please. Answer is what is 2? What is 2? What is 2? Massaging the area after removing the needle. All right. The question said, what should the nurse avoid doing when administering that medication intradermally? Okay. The answer is what is 2? Let me see who got that one first. Remember, it's first on my screen. That said what is, and that was Monique Fessler. Hey, Monique Fessler. Monique Fessler. Okay, and you got 500 points. Awesome job. You are now on the scoreboard with 500 points. Okay, remember, the person with the highest amount of points at the end of this will win a free digital Ultimate Nursing School bundle. $97 value, yours for free. That's my thank you for participating in this weekly review. All right, so who else got 2? You may not have been first, but if this was the NCLEX, you would have got those points. You would have got it correct. So, silver linings. Remember, we're just doing this because it's fun and playing for incentive. But in the actual real deal, what you should be practicing for is getting the answers correct and making sure you understand why. All right, so D. Junie also got it. Southern Belle, Tattoo Poo, Catherine, Anna, Ermani, Queen Niece, Bree Nicole, The Social Anomaly, Kelly Joe, NC Pink Rose, great job, Fally Fowl, 360 Me, Kiss My Dimples, K Loves Hugs, Hey Adana, Ebbs. You have to wait until you finish reading. No, you do not have to wait until I finish reading the question and answer. That's why I said I'm going to make sure you guys see the questions as well. Because some of you guys, we all read at different paces. Some may be super fast readers, but remember, reading fast is the point. You have to make sure that you understand what the question's asking, no matter if you understand that in 2 seconds or 1. Okay, so that's the point. So I'm going to make sure you guys see the question. I'm also going to read it as well, just in case there's auditory people here as well. But when you see the question and answer choices and you know the answer, go ahead, have at it. N Crystal D also got it. Tai Wo, Star Nurse, P. T. Hova, awesome job. Someone said you administer IM. This is an IM. This is intradermal. That's what happens when you read fast. That's what happens when you read too fast. Intradermal. It's not IM. Okay. Wait, whose birthday? Future ER nurse, happy birthday! Happy birthday! Future ER nurse has definitely been one of our winners. All right, from previous NCLEX Jeopardies and Tease Tuesday, I believe. So what's up? Welcome. Thank you for spending your birthday with us. All right. NC said upgrade. This is fancy. Ew, right? I told y'all I'm giving y'all the experience. Okay. All right. Perfect. Great job to everybody that got what is 2. Great job. And then once again, great job, Monique. You got those points. All right. So let's go ahead and go over the rationale as to why it was 2. Massaging the area after removing the needle. That's what you want to avoid. Okay. So an intradermal injection. All right. That's administered with the needle bevel facing up and at a 10 to 15 degree angle. Whatever you are trying to, especially intradermals, you want to make sure face down, bevel up. Face down, bevel up. Your face is down and the bevel of that needle is up. Bevel is always up. Okay. Intradermally, that angle is going to be 10 to 15 degrees. Okay. Someone just put that IMs were 90-degree angles, and that is factual. IM injections are 90-degree angles. Give me an example of an intradermal injection. Give me an example of an intradermal injection. Give me an example right here in the comments. Intradermal injection. What is an example of an intradermal injection? Come on. PPD. PPD, tuberculin skin test, which is the PPD. Yes, absolutely. TB or PPD, however you want to say it. But yes, absolutely. That is that type of injection. So what happens with intradermal injections, okay, once again, you have that needle. Your face down, bevel is up. All right? When that bevel is up, you are going into the skin. Oh, wait, what's it? I'll bring that out on a later date. But yeah, this is your arm, or what else? Say that this is your arm. So and this is your injection. You're going in at 10 to 15 degrees, right under that skin. Okay. And then when you inject that medication, you inject it slowly, and that usually leaves what they call a bleb. Okay, that bleb should form under the skin. It's supposed to say LMNOP. What does that mean? That's funny. Yes. But yeah, that goes right under the skin. And then after you withdraw that needle, what you can do, don't rub it, because once again, with TB or tuberculin skin test, what they're doing is they're assessing to see if there's going to be a reaction. Okay, so that area should not be rubbed at all, because if you rub it and it has that medication, we're trying to see if we have a reaction to medication. So if you rub it and spread it all over, it's gonna look like you have a reaction whether or not you have it or not. You're aggravating it. Does that make sense? So what you want to do is pat it. You don't want to rub it. You want to pat that area. And once again, since they're measuring to see if there's going to be a reaction, what they're going to do is mark, or like draw a circular mark around that bleb, or that area of injection. And then that's what they're going to use to reference it later. Okay? Okay, confession. All right, so you know how I know so much about that? So you know, a tuberculin test, once again, if they do it, when they do it intradermally, it leaves that bleb. They say, obviously, do not rub it, do not scratch it, don't do none of that, because it can give us a false positive. It's going to look like you had a reaction to it. So I was like 5 when I was giving mine. And I don't know about y'all, but if y'all tell a 5-year-old not to do something, maybe it was just me and I was bad. But first of all, it itched, so I was going to scratch it. All right, so long story short, they couldn't tell if it was a reaction or if it was just me scratching because I did the one thing they told me not to do. So just in case, I had to be treated prophylactically anyway. And they had to put this nasty medication in my orange juice, and it really turned me off to orange juice for a long time. So I just became that student in your class that has a story for everything. You're welcome. I've always wanted to be her. You're welcome. So I wish you talked about the teas as well. I do those on Tuesdays. Southern Belle said I wish you taught at my school. Oh, thanks. Thanks. All right, let's go ahead and go to the next question, guys. Next question. All right. And this one is going to be Peds for 300. Peds for 300. All right. A mother brings her child to the Well Child Clinic and expresses concern to the nurse because the child has been playing with another child diagnosed with hepatitis. The nurse prepares to perform an assessment on the child, knowing that which finding would be of least concern for hepatitis. Okay? 1, jaundice. 2, hepatomegaly. 3, dark-colored frothy urine. Or 4, left upper abdominal quadrant pain. What's going to be our answer? Remember, try to take typically a minute to answer these questions. Okay. All right. So once again, we have let's try to figure out what the question's asking us beneath all this fluff. Okay. Mom brings a child to the clinic and she's concerned because the child's been playing with another child that has hepatitis. So clearly the mom wants the child to be checked to make sure that her child does not have hepatitis. So the nurse prepares to perform an assessment on the child, knowing that which finding would be of least concern for hepatitis. All right, so that's what the question's asking. We're looking for a finding that is, once again, that would cause least concern for hepatitis. All right, so 1, 2, 3, or 4, what is our answer? Yeah, I'm getting lots of 3s. Lots of 3s. All right, let's go to the answer. What's this? For 300? Okay, great. Peds for 300. And the answer is, drum roll, oh please. What is 4? What is 4? Left upper abdominal quadrant pain. That is going to be the least cause for concern. All right, why? If you're having pain from your liver, what side is it going to be on, left or right? Right. All right. It's going to be on the right side. So if you're over here complaining of left upper abdominal quadrant pain, that don't have nothing to do with what we're talking about. So maybe that might be gas or something else. But if of these symptoms, you say, hey, I'm also having left abdominal pain, then, okay, at least it's not right, girl. At least it's not right. All right, because the right side is where you would be most concerned. If you had right upper abdominal quadrant pain, cause for concern. Okay. Wait, let me scroll up before I finish. Let me scroll up and see who got what is 4 first on my screen. Bree Nicole 12. Good catch. You got those. So you have 300 points. Monique Fesser, you have 500. Great job, guys. All right. Who else got what is 4? Boop. Let me like that. Great job. Who got what is 4? Wallflower. Hey, boo. Hey. Welcome back. Great job. Good catch. Glita. Miss Exclusive. I'm trying to okay, great. Alan Tay. Awesome job. Someone said, ooh, that was a trick. I know NCLEX be trying to get y'all. They be like, I'm not trying to trick y'all. I'm asking questions. But that's what happens with sometimes when we read too fast. And when certain things just pops into our mind, we kind of go with that. Yeah. Cautiously read those questions because they're never trick questions, but sometimes those words will be hidden in there to trick you. I don't know how that's not the same thing. But yeah, that's what they'll all say. We're not trying to trick y'all. We just want to make sure that you're comprehending and really reading the question. Yeah. But great job to the people that did catch it. If you didn't catch it, that's fine. But the good thing about practicing is that, especially when you're practicing questions and content and stuff, it's like once something gets you once you got once, you're like, I will never get got again. Okay? Left versus right for hepatitis will most likely never get you guys again, just because you're like, I'll never get that one wrong. All right, so great job to everyone that got that one. All right, so jaundice. If someone has jaundice, first of all, what is hepatitis? What is hepatitis? Y'all know itis? Hepat. All right, let those kind of word abbreviations and let that kind of help you. All right, itis is inflammation. Hepato, liver. Inflammation of the liver. Okay? So number one, jaundice. That's the yellowing of the sclera. Okay? It says right here, jaundice may be present and will be best assessed in the sclera, which is the whites of the eyes, nail beds, and mucous membranes. All right? Inflammation of the liver. Great job. Hold on, someone. You should be able to see, even with the questions, it's above where the questions, the comments end. And I designed it that way on purpose, just because the questions in the comments can sometimes block it if I didn't do that, but they were all above it. What was I saying? Okay, yeah. So yes, that's how you assess for jaundice. As far as the stools, they're saying rotate it. Mine's on rotate lock, so I would have never guessed that one. But yeah, try rotating it, kind of not vertically, but horizontally. Stools will be pale and clay colored, and the urine will be dark and frothy. So dark colored frothy urine, that would definitely be cause of concern for hepatitis, or something having to do with liver. And then same thing with hepatomegaly. Megaly means large. We just said what hepato means, liver. So hepatomegaly just means an enlargement of the liver. That's not normal. Damn, it is. I'm on my phone. Why that's so weird. That is crazy. But yeah, try rotating it. Maybe it's because I'm the one that's actually on live, so I can't see it. All right, let's try it. Next question. All right, so we got that one. Next question. Let's try this one. All right, so yeah. So I'm definitely going to read it as well. We just did, I forgot the first one we did. Fundies? Maybe. No, it was something else. Whatever, I can't remember. Oh, yeah, it was fundies for 500, pediatrics for 300. Now let's do mental health for 400. And ready, set, go. All right. So even right here, y'all can't see the questions. Yes, this is every Thursday, unless I'm like deathly ill. All right, here you go. The nurse is developing a plan of care for a client admitted to the mental health. 1 second. Go. No. Go. No. We're going to go here. Sure. The nurse is developing a plan of care for a client admitted to the mental health unit with a diagnosis of obsessive compulsive disorder. What is the nurse's priority in the plan of care? Priority. Okay? Do not let that go over your heads. Okay? What is the priority, which usually means first thing? What is the first thing, okay, that this nurse has to do in the plan of care? 1, monitor for repetitive behavior. 2, demand active participation in care. You better participate. 3, educate the client about self-care needs. Or 4, establish a trusting nurse-client relationship. Did anybody say what is 2? Did anybody say what is 2? Same time every Thursday. Thursdays at 7 p.m. Absolutely. Did anybody say what is 2? Thank God. Y'all know that you better give me some snacks. Or beat your ass. That's what number 2 is. All right, so the answer is, what's this, mental health? Great. The answer is, what is 4? The answer is, what is 4? I saw a lot of 1s and 4s. So great job to everybody that said 4. Let's go ahead and see. Remember, this is mental health. All right. Who's the first person to say what is 1? No, I meant 4, sorry. What is 4? What is 4? Bree Nicole. What's up, Bree Nicole? You're already on the scoreboard with 300 points. This one is 400 points. Right? Yes, it is. This one's 400 points, so you just got an extra 400 points added to your score. Bloop. So you now have 700. Awesome job. And you're in first place. Great job, Bree Nicole. Who else got what is 4? Remember, just in case you weren't first, if this was NCLEX, you would have got it. Ash is the 1. Queen Carol, Ermani, Wallflower, it's Kay. Tiff is blessed. Dijuni, nurse to my girl. Or no, nurse to my girl. Am I joking? Nurse Tommy girl, what's up? Tolu, Mama Mia, the social anomaly. I am the ambitious one, Miss Exclusive, Hey Adana, Chasing Nurse Dreams, Maria, Carmel Coded Girl, Angie Green, Real Vince, Stevie D, PT Hova, Benta Kib, what's up? Awesome job. Bree Nicole said mental health patients need to establish a trusting relationship first. Absolutely. All right, so remember that P word, priority. What is our priority? All right, the priority is to establish a trusting relationship with the client. All right, demanding anything from the client should never occur. Go to PT. That's never going to happen. That's not going to work out in your favor. The remaining options are appropriate components of the plan care, which means they are not wrong. Okay, those are not wrong options for this care plan, but that's not what the question's asking. The question's asking, what is the nurse's priority? So even though those are appropriate things to do, and which you should, or appropriate components of the plan of care, it's not what the nurse should do first. It's not his or her priority. Okay, so that's why that priority is very, very important. Okay, so you must first establish a trusting nurse-client relationship. Okay, think about when you go and I don't know. Think about pretty much anything before you go to somebody. Like, perfect example, before you go to somebody and ask for money or something like that, or before someone comes to you and asks for money, do they ever just be like, hey, give me some money? Maybe sometimes. But usually they try with the fake conversation. Hey, how you doing? You been okay? Good. They're trying to establish that relationship first. Remember me? I'm that cousin. I'm that friend. Okay, great. Can I have $300? They want to establish anything first before they do whatever. So kind of think about that when you think about mental health patients. Not really them asking for money, but just think about the fact that specifically with mental health, you want to establish trust. Establish trust. Okay, I said it. All right. Awesome. All right. Next question. That was mental health for 400. Let's do adult health for 5. If you need to scroll to see that, I'm gonna read it as well. The nurse is providing discharge instructions to the client being discharged after fenestration procedure for the treatment of autosclerosis. Which statement made by the client indicates a need for further instruction? 1, I should use a straw to drink liquids for the next 2 to 3 weeks. 2, I need to avoid washing my hair and showering for at least 1 week. 3, I should avoid movements requiring bending over for at least 3 weeks. Or 4, I should take stool softeners to avoid straining when having a bowel movement. What is our answer? What is our answer? Yes, every Thursday, 7 p.m. for NCLEX Jeopardy. All right. What is that answer, guys? Which statement made by the client indicates a need for further instruction? Remember what the question is asking. Don't go by what you think it's asking. Go by what it's actually asking. Oh, this wasn't. Okay, cool. That happens every time. All right, so I'm gonna scroll back up, scroll back up, scroll back up. See what our answer is. All right, let's see what our answer is, guys. What was this? Adult health for 500? Okay. The answer to adult health 500 is, what is, drumroll please, what is 1? What is 1? I should use a straw to drink liquids for the next 2 to 3 weeks. Absolutely. Absolutely. All right. Let's go back to the actual question. All right, remember the client was being discharged after a fenestration procedure for the treatment of autosclerosis. Auto, what does that prefix mean? OTO, what does that prefix mean? While you're answering that, let me see who is the first person to get what is 1. I think, yeah, wait, scroll. Ash the 1. Great job, Ash the 1. Ash _1 and then 1. Great job. So you have 500 points. Great. Who else got what is 1? Wildflower, awesome job. NC Pink Rose, Real Vince, 4 Little Heartbeats, Benta Kib, even though you said you're not sure, look at you getting the answer right. Tiff is blessed. All right, auto means ear, absolutely. Great job to everyone that got what is 1. Auto means ear. So after ear surgery, clients need to be instructed to avoid drinking with the straw for 2 to 3 weeks and to avoid air travel and excessive coughing, because all those activities will increase the pressure within the ear. That's not what you want to do right after ear surgery, okay? Similar to how when you're having, like when you get your dentist work, when you get a tooth removed, and they tell you, like if you get your molars removed, they tell you don't drink through a straw because it can cause like a dry socket or something like that, dry pocket, dry socket, whatever. It's because of that pressure. Okay, that pressure is increasing, and it has to go somewhere. All right, so you don't want to cough. I know bend over. Avoid air travel, especially air travel. Oh, yikes! All that, because that will increase the pressure within the ear. Okay. It says the client should avoid getting the head wet, washing the hair, or showering for at least 1 week to avoid any of that getting into the ear, which is the surgery site. Hold on. Wait for it. Wait. Hold on. I lost where I was. Yes. Okay. Showering for at least 1 week and avoid rapidly moving the head, bouncing, and bending over, for at least 3 weeks. The client also should be instructed to avoid straining when having a bowel movement and should be instructed to take stool softeners as prescribed. Can't even think about this. Patty was really that tough on the toilet, right? That's funny. But yes, the answer is what is 1. Okay. I should use a straw to drink liquids for the next 2 to 3 weeks. Nope, no straws, because that sucking motion increases that sucking action increases the pressure within the ear. Okay. That was adult health for 5. Let's go to a next one, which was pharmacology. This one's Farm for 200. Farm for 200, guys. Farm for 200. Okay. A cromolyn sodium inhaler is prescribed for a client with allergic asthma. The nurse provides instructions regarding the adverse effects of this medication and should tell the client that which undesirable effect is associated with this medication. 1, insomnia. 2, constipation. 3, hypotension. Or 4, bronchospasm. What is our answer? All right, cromolyn sodium, that is the medication. Remember, this is pharmacology for 200. Let me go to it, actually. Great. Yes, so we're looking for... All right, we're looking for the undesirable effect. So obviously undesirable. Which one don't you want to happen? No thank you to this one. I don't want this one to happen. This one's particularly undesirable. Return to sender, I don't want it. Which effect is associated with this kind of medication? Cromolyn sodium. What is our answer? And our answer is we're either all right or all wrong. What is 4? Bronchospasm. Great job. Great job. Remember, there's a difference between side effects and adverse effects. All right? Adverse, I don't want these to happen. These are pretty shitty, okay? Side effects may be a little annoying. But adverse effects, no thank you. All right, first person to get what is 4 and say what is Katie K. Anya. Great job. All right, so Katie K., you are now on the scoreboard with 200 points. Katie K.
I found this on the web.
No one's talking to you, Siri. I didn't ask for that. Thank you. Thank you, though. Thank you. All right. Great job. Who else got it? Pretty much everybody. Benta Kib, Catherine, Queen Niece, Ash the One, Real Vince, Four Little Heartbeats, Hey Adana, Caramel Coated Girl, Wallflower. Awesome job. So, cromolyn sodium, that is an inhaled non-steroidal anti-allergy agent and a mast cell stabilizer. Undesirable effects associated with inhalation therapy of cromolyn sodium are bronchospasm, cough, nasal congestion, throat irritation, and wheezing. Clients receiving this medication orally may experience pruritus, which is another word for what? Pruritus. What is another word for pruritus? All right. While y'all tell me that, I'm finished reading. Clients receiving this medication orally may experience pruritus, which y'all are about to tell me in layman's terms what that means. Nausea, diarrhea, and myalgia. Myalgia is muscle pain. Yes, pruritus. Another name for pruritus is itching. Pruritus. Okay, pruritus is the fancy way of saying itching. Okay, yes, itching. All right, great job to everyone that got what is 4. Acromelin. I keep saying acromelin, but chromium sodium, but an inhaler version. All right, so great job, guys. Next question. Pediatrics for 100. Pediatrics for 100. The nurse provides feeding instructions to a parent of an infant diagnosed with gastroesophageal reflux disease, or GERD. Sure. Which instructions should the nurse give to the parent to assist in reducing the episodes of emesis? Emesis, which is another word for what? Oh, well, y'all answer. Y'all answer first, and then tell me what emesis means. Tell me what emesis means after you finish answering. Or you can answer all at once, whatever. However you want to do it. Tell me what emesis means. Anyway, 1, provide less frequent, larger feedings. 2, burp the infant less frequently during feedings. Yes, emesis means vomit. Great job. Indicate social anomaly. Great job. 3, thin the feedings by adding water to the formula. Or 4, thicken the feedings by adding rice cereal to the formula. Awesome job. Great job to everyone that knows that emesis is another word for feedings. Great job. All right. I'm seeing 4s. I'm seeing 1s. But more so I'm seeing 4s. All right, let's look and see what that answer is. Y'all ready? Let's look and see what that answer is. What is this? Peds for 100. And the answer is, what is 4? Thicken the feedings by adding rice cereal to the formula. Great job. All right, so it says gastroesophageal reflux, or GERD, is backflow of gastric contents into the esophagus as a result of relaxation or incompetence of the lower esophageal or cardiac sphincter. Small, more frequent feedings with frequent burping often are prescribed in the treatment of GERD. All right, so small, yet more frequent, okay, with frequent burping. That's going to, that's usually prescribed. And then feedings thickened with rice cereal may reduce episodes of emesis, vomiting, which is exactly what the questions ask us. It said, what instructions should we give to the parent to assist in reducing the episodes of emesis? And it didn't ask us about GERD. Okay, it says if thickened formula is used, cross-cutting of the nipple may be required. So that's, I guess that's when they go like that to the, wait, what? To the nipple of the bottle, correct? Or y'all just going out here y'all out here cross-cutting y'all mama's nipples? That's too much. Too much. But no, they mean cross-cutting of the nipple of the bottle. Okay? Who got that one first? I'm scrolling. You won't pick my soul. Catherine 518. Catherine 518. Great job. Catherine 518, congratulations. You're the first person on my screen to answer that correctly. You now have 100 points. Great job. Who else got it Operate Her Pro. Thank you so much. You said this so good. Awesome. I'm glad you guys are enjoying this. What is it? Ash the One also got it. Katie K, Queen Niece, Queen Carol, Benta Kib, Kills All Competition, Ola Detonia, Hey Adonna, Future ER Nurse, Criminal Coded Girl, Abriana. I'm Ambitious One said, I remember seeing a question like this on the exit exam. Period. See why practice is important? Thank you for saying that. Okay, great. I went by? I said it right? Great. Awesome. All right, next question. Next question. Great job, everyone. Okay. Fundamentals for 200. Fundamentals for 200. All right. Hey, Boo. Hey, Morgan. Someone said I was before. Not on my screen. Remember, I can only go by what I see on my screen. And on my screen, that person was first. All right. Okay. Fundies for 200. It says a client is receiving an intravenous infusion of 1,000 milliliters of normal saline with 40 milliequivalents of potassium chloride. The care unit nurse is monitoring the client for signs of hyperkalemia, which finding initially will be noted in the client if hyperkalemia is present. What I like to do is reread that last part, like the actual part where they're asking the question. Which finding initially will be noted in the client if hyperkalemia is present? 1, confusion. 2, muscle weakness. 3, mental status change. Or 4, depressed deep tendon reflexes. What is our answer? What's that? Fundies for 200? What is our answer? And the answer is, what is two? Muscle weakness. What is 2? Muscle weakness. Muscle weakness, guys. Since potassium plays a major role in neuromuscular activity, elevation in serum potassium initially causes muscle weakness, as mental status changes and confusion are most likely to be noted in the client experiencing hypocalcemia or low calcium in the blood. Depressed deep tendon reflexes are noted in the client with hypermagnesia. So it was 2. If you got this question wrong, first of all, it's okay. All right, but make sure that you sign up for Sunday Study Hall this Sunday, June 26th at 6 p.m. It's free for everybody. All right, free for everybody. We're going over common NCLEX lab values. All right, common NCLEX lab values. Okay, so we're going to be going over hyper and hypos, especially of electrolytes, okay? If you guys don't have the little free sheet that I have, make sure you go to my thenursing.com and go to my freebies and download the the nursing school study workbook. It's like 35 pages or something like that. But it includes this and a whole bunch of freebies, okay? If you want to sign up for the free Sunday Study Hall, go to the link in my bio when this is done, or just, go to the link in my bio when this is done and click on the first link. It's going to say sign up for Sunday Study Hall. So all you got to do is just put your name and your email so we can remind you when it is, and that's it. Okay? So, who got this one? Who got this one? Who got this one? Was this was too? Okay, great. Benta Kib. Benta Kib got this one. Awesome job. Bent Kib. Perfect. Awesome. So who all got what is two? Remember, just in case you're not first, as long as you're answering it means you're understanding the content. Okay? Benta Kib got it. Nurse Tommy Girl. Monique Fessler. Wallflower. Ash the One. Hey Adon. Oh, wait, no, not that's a three, sorry. Envy. What's that? Nausea vomiting. I'm just kidding. Nurse E3. Only One Vinny. Oh, Thick Thighs and Peaceful said confusion and mental status change are the same to me. Because they are similar, maybe that's why those two weren't the answer. You feel me? Because a test taking strategy is that you look for two, especially with multiple choice, you look for two answers that are opposite or the same. So if it was like, confusion, mental status change, those are too similar to be different answers. Okay, so 2, which was muscle weakness, was the correct answer. All right, who else got that? Ooh, boop, boop, boop. Perfect. All right, moving on. We're almost done. What was that we just did? Fundies. All right, let's do mental health. Yep, mental health for 300. Mental health for 300. The nurse observes that a client is pacing, agitated, and presenting aggressive gestures. The client's speech pattern is rapid and affect is belligerent. Based on these observations, which is the nurse's immediate priority of care? 1, provide safety for the client and other clients on the unit. 2, provide the clients on the unit with a sense of comfort and safety. 3, assist the staff in caring for the client in a controlled environment. Or 4, offer the client a less stimulating area in which to calm down and gain control. What is our answer? What is our answer? I have a lot of people saying 1. I'm so glad. Do not say 2. Do not say 2. Please provide me with actual comfort and safety, not a sense of comfort. And I'm sensing that I'm safe here, but am I actually safe? That's funny. All right, let's look and see what the correct answer is. Our correct answer is, what is 1? Provide safety for the client and other clients on the unit. Keep them safe. Keep them safe. Do y'all know that that's the actual theme of the NCLEX? No, I'm not talking about I'm not talking shit, but really the purpose and the theme of the actual NCLEX is client safety. Look, Google it. It's client safety. So obviously that's going to be your end goal. That's your, I wouldn't say that's your purpose of a nurse, but you're making sure that client safety is obviously your top priority. Because if they aren't safe, they're in harm's way. If they're in harm's way, you're not going against, but your shift as a nurse isn't going to be the best. Let's say that. Okay? So safety of the client and other clients is the immediate priority. Remember that whenever you see priority, think of what you're going to do first. Okay? Immediate priority. And then it said immediate too. How much more immediate can I get? The correct option is the only one that addresses the safety needs of the client as well as those of the other client. Okay, so the answer was, what is 1? I don't know if I said who got that one. I did not. Let's see. What is 1? Who's the first person? Katie K. Katie K got it first on my screen. What's up, Katie? You're already on the scoreboard with 200 points. This was 300, so you just got another 300 points added. So now you have 500. All right. Awesome job. Who else got? A lot of people got what is one. Katie K, future ER nurse. D. Junie, Ash is the one. Monique, Nurse Tommy Girl, Wallflower. Queen Carol, Jazzy. Four Little Heartbeats, I am the ambitious one. Hey Adana, PT Hova. Caramel Coated Girl, only 150. Benta Kib, D. Cag, Zara, Kills All Competition. NC Pink Rose, great job, great job, great job. Great job. As far as when the NCLEX changes, it is changing in, like the composition is changing, not the content. Content's staying the same, okay? So you're going to have new question types and a new scoring system. There's going to be more information about that. As well as more practice in the new types of question and alternative item formats. We're going to have that. But the content's going to stay the same. Absolutely. Content's staying the same. Okay. And that's not till at least next April. So as we get closer to that date and then give us more information to go off of, we're going to go off of that as well. But for now and the rest of 2022, y'all got the same old good old NCLEX. So we're gonna ride it out for that one. Okay. Y'all want to do one more? I take mines in July. Yeah, you're good. It's they said it's gonna start April 2023. So everybody up until April 2023, you're taking the same one right here. Okay. All right, y'all want to do one more? Okay, one more. Pharmacology for 500. Pharmacology for 500. A client is prescribed tranylcypromine. The nurse educating a client about tranylcypromine should instruct the client to avoid which activity? 1. Drinking any amount of wine. 2. Consuming any fresh dairy products. 3. Exposing the skin of the face to the sunlight. Or 4. Eating either fresh or frozen green leafy vegetables. Tranylcypromine. If a client is taking tranylcypromine, what should you as the nurse instruct them not to do? What should they avoid? Okay? What should they avoid? All right? So picture this. The doctor already gave them prescription, blah, blah, blah. Now you're giving discharge instructions. Hey, Mr. So-and-so, I see that the doctor wrote for tranylcypromine. Do you know what that is? Blah, blah, blah. You want to make sure that you avoid doing what? Okay? All right? Very real thing that can happen. That's what the nurses do during discharge instructions, like almost word for word. Okay? So what is it that we are going to avoid doing with if we're taking tranylcypromine? Let's look and see. Wine or red wine? Now I'm confused. Don't confuse me. All right, let's look. All right, and the answer is, what is this again? Oh, farm. What is 1? Drinking any amount of wine. Any amount. So it don't matter if it's red wine, white wine, dessert wine. It doesn't matter. No wine. Okay? No wine. At all. All right, so tranylcypromine. That is a monoamine oxidase inhibitor, or MAOI. MAOI. So, and that is used to treat depression. Okay, so first of all, it's usually no alcohol with MAOI, or no alcohol period with antidepressants. So you could have got it there. But more specifically, the type of antidepressant this is an MAOI. There's certain things that you definitely have to stay away because of the chemical makeup of this medication. So any food and fluids containing tyramine, such as, oh dang, I wish it didn't, I wish they didn't say what the foods were for tyramine, because that was about to be my second question. All right, so foods and drinks containing tyramine, aged cheese, smoked or pickled meats or poultry, fermented meat, beer, wine, liquors, all those. They should not be used while someone is concurrently taking MAOIs because it can cause sudden and severe hypertensive reactions. Okay? Is that serotonin syndrome? Right? Is it? MAOI. Oh, wait, wrong thing. MAOI. OI. And avoid alcohol. Is it serotonin syndrome or is it just really high? I can't remember what it actually is. Like the name of what it is. Y'all know? MAOI and serotonin. So let me just look up serotonin syndrome. Okay, I think so. No, it's just hypertensive crisis. Thank you. That's the word. Hypertensive crisis, MAOI. Absolutely. Great job, guys. MAOIs can cause a severe spike. Taking tyramine, mixing tyramine with MAOIs cause hypertensive crisis, not serotonin syndrome. That's SSRIs. Great job. Bentakib said, oh, this is important. I saw the same thing. I saw raisins and dried cranberries in a question for MAOI. That's funny that you said that because I did as well. I absolutely did as well. You know, no actual names of these types of foods. So aged cheese, like sometimes they'll have a cheese, like they'll be like cream cheese or Swiss cheese, something like that. Smoked or pickled meats or poultry, pickled sausage, like pepperoni, no like names of pickled meats and smoked meats because they will actually put the types of food or the names of some of the types of food, the specific types of food, and not just something, general like aged cheese. Sometimes they'll put the specifics. Okay. What contains tyramine? Yeah. Serotonin syndrome is high fever. Absolutely. Serotonin is high fever. Yep. All right. So you want to avoid things that have high tyramine. If you have the Ultimate Nursing School bundle or the individual Nurse Eats kit for the diets and stuff, it has a list of foods that have tyramine in it. Okay. Great job. All right, there's actually one more. Someone said, this is your one more. All right. Wait, did I say, ooh? Answer that, but let me see who got that last point. Go ahead and answer that. Let me see who got the last point. What was that? That was something for 500. That was farm for 500, I believe. Wait, let me scroll. Let me see who got the last one. Ash the One got it last. Yeah, that was farm for 500. All right, Ash, you had 500 points, so you just got another 500 for answering that last one correctly first, so you are now at 1,000. Great job. All right, now this one. The nurse provides education about the tetanus toxoid and administer it to the client via injection after stepping on a nail while walking on the beach. Which statement by the client indicates successful teaching? 1, the tetanus toxoid is caused by viruses. 2, the tetanus toxoid is caused by parasites. 3, the tetanus toxoid is an optional treatment, so I really don't have to have this. Or 4, the tetanus toxoid are toxins that have been altered so that they are no longer toxic. This is Fundies. No, I lied. This is not Fundies. This is Adult Health for 400. Great. All right. So what is our answer? I'm scrolling all the way down. Because I had to scroll all the way back up. Okay. All right. Let's look and see what that answer is. We're looking for the statement that indicates successful teaching. So we're looking for the statement that makes sense, the statement that shows that they understand correctly what you just taught them. Okay? If it was a need for further teaching, we will be looking for incorrect statements. So make sure you know the difference between those. All right? So the answer for this one is, what is 4? What is 4? And I'm already at the top. Ash, the one, is the first person that get this one. So Ash, you got another 400 points, putting you in first place with 1,400 points. Okay. Who else got what is 4? Monique got it. Close game, Monique. Great job. Katie K. Great game. Close game for you as well. Great job. Binta Kib. Awesome job. NC Pink Rose, Envy, I'm the ambitious one, only one Benny, Trina J, awesome job. All right, so it says toxoids are toxins produced by bacteria that have been altered so that they are no longer toxic. Their important antigenic receptor sites remain intact, enabling antibodies to the antigen-producing toxin to be produced. The remaining options are incorrect statements. Someone said Ash cheated. How she cheated? Y'all are so funny. Y'all are so funny. Ash, the one, do you have the Ultimate Nursing School bundle? The digital one. Do you have that one already, love? I need to know. Yes or no. Do you have the Ultimate Nursing School bundle? If you already have it, well, I'm just, you know, perfect, awesome. You just won the Ultimate Nursing School bundle. Woo! Great job. Awesome. Awesome. So, like I said, congratulations. You are the winner of the digital Ultimate Nursing School bundle. You can go ahead and send me in a DM your full name, first name, and last. And your email address so I can go ahead and send this to you. It says, I'm just NCLEX ready or trying. I got less than 3 weeks to take it. Everybody get these right. Right, period. Great job. Great game. Okay. If you are about to attack, in 3 weeks, you're about to attack the NCLEX with the same fervor as you did during NCLEX Jeopardy, you're going to be fine. You're going to be fine. And I have the utmost faith in you. Katie K, you gotta be ready. You gotta be ready. Always stay ready. That is so funny. All right. So if you guys do not have the Ultimate Nursing School bundle, what are you waiting for? Okay. All right. So first things first, if you guys liked having the questions up as we did it, give me a thumbs up. Tell me how you liked this session better than the ones in the past, which were, y'all couldn't see the questions. But do you guys like/prefer this method or doing it this way? Do you like being able to see the questions? Thumbs up. Awesome. Perfect. If anybody is going to be studying for their T's or taking their T's, we do the same thing on Tuesdays for T's Jeopardy. And we'll have questions. You'll be able to see the questions on next Tuesday, as well. Okay, so I'm glad you guys prefer this way. Good. Oh, I can't wait. Okay, great. I cannot wait I'm going to screenshot this and send this to my husband, because he was like, you're doing too much. You're doing too much. Blah, blah, blah. You're a perfectionist. I was like, no, for real. They would really appreciate and love it, because he's not a visual learner like we are. He's not a visual learner, so he don't get it. He don't get it. But thank y'all so much. Can somebody actually write in the comments, so I can screenshot it? Somebody right here in the comment, write, you need to listen to Sam more. Just write it. just somebody please do me the favor so I can screenshot it real quick. Just put, Sam is the best. Sam is the best, and you need to listen to her more. All right? Hold on, I'm screenshotting all of it. Wait. Hold on 1 second. I prefer the questions on the screen, period. Boom. So it's listen to Sam more. Hold on, I'm gonna screenshot the shit out of this. Thank y'all so much. Thank y'all so much. This is so funny. Right, I know what I'm doing. Duh. Y'all are awesome. All right, perfect. All right, so moving forward, whenever we do NCLEX Jeopardy, which is every Thursday at 7 p.m., unless I have to push it to Friday or something like that, whatever, or just miss it that week because I can't breathe, whatever the case may be. But we do it more often than we don't do it, or we skip it. All right, so next Thursday at 7 p.m., we're gonna be back in here with our questions. If you guys want to, we just did 10 questions. If y'all want to play the other 15, there's still 15 questions. Okay, we didn't play all of them. All right, if y'all want to play the other 15 for free, hold on, let me go ahead and actually. Boop, there you go. If you want to play the other 15 for free, download the Nurse Sam app. It's literally called the Nurse Sam. All right, it's 100% free. Download the Nurse Sam app, and when you download it and open it up, go to NCLEX Prep. You will see NCLEX Jeopardy Mobile. You will be able to play all 25 questions. All right, you get 25 new questions every week. All right, so I'm actually going to update the questions in the app now, so that you can get the rest of the questions from tonight's game. Okay? So I am going to put that into the page now, so that when you guys download the app, you'll still, if you have it open now, if you have the app now, you're still able to see the 25 questions from last week. But after we go through live, I update it to be the 25 questions from this week. Okay, so I am going to update that. If y'all want to see the actual replay of this, make sure you're a member of the Study Bar community at studybarcommunity.com. All right, we just lowered the membership fee. It is now $14.99 per month versus $29.99 per month. Okay. So $14.99 to be a member, and you can see we have like 25 plus replays each of NCLEX Jeopardy and Tease Tuesday, plus other videos that's definitely going to help you with the NCLEX, as well as the full NCLEX Arcade, all that. All right, so I'll see y'all. Oh, thank you guys. I'm so glad y'all like it. Perfect. All right. So once again, download the app. It's 100% free. The questions are free. All right. I want to make sure y'all get practice. Really does make perfect. And after you guys graduate, or as you're getting closer and closer to your NCLEX date, practicing those NCLEX questions it's your best teacher. All right, that's why I choose to do NCLEX Jeopardy every week. That's why we do Sunday study halls on Sundays now, because I want to make sure you guys are getting the content as well as the strategy behind how to answer these questions. Okay, you need to tackle it from both ends. All right, you won't pass if you just have all content, no strategy, and vice versa. All strategy, no content. You won't pass. You need a combination of both. All right, and the best way to do that is attending reviews, practicing questions, and lucky for you, I have free versions of all that. All right, if you want more of it, you can either become a member of the Study Bar community for $14.99 a month, or at studybarcommunity.com, or you can get my Ultimate Nursing School bundle, or the NCLEX Arcade if you guys want more paid content. All right, so thank you guys so much. Let me look and see what y'all are saying. Why is this taking forever? Okay. All right, now we're good. Now we are good. And once again, if you want to play the tease version on Tuesday, we have it Tuesdays at 7 p.m. So tease are Tuesdays at 7, and NCLEX Thursdays at 7. All right. All right, so I'm about to update this so you guys can see. Ash, don't forget to DM me your name and email address so I can send you your prize. All right, and that's been updated. All right, so that's been updated. You are now able to see the 25 new questions for this week. Next week, we'll change them to another 25. Okay? Thank you guys so much. I will see y'all next time. Do not forget to sign up for Sunday's study hall. Free study hall. You don't have to be a member to come to the study hall on Sunday. It's completely free and open to the public. If you want to see the replay, you have to be a member. But to come to the live Sunday study hall, Sunday, June 26th at 6 p.m. Okay, click the link in my bio to register. Click the link to register and get all the information you need for Sunday study hall. We are going over this week common NCLEX lab values. Okay, so electrolytes, complete blood count, urinalysis, all the stuff, all the important lab values that you need to know, whether you're an RN student or an LPN student. You need to know these values because you will be tested on it. All right, I will see you guys Sunday. If y'all not there, you're square. All right, and then I'll see you guys next Thursday for another one of these with the questions on the screen. All right, thank you guys so much, and I'll see you next time.